Alrighty, Body Architect, how is everyone doing? Welcome to Kinstretch Season 1, Episode 2, and today we're going to get started with a little concept called irradiation. Irradiation is when we use contractile forces to engage all the way up to help isolate the facilitation of a joint. For this, I'm going to grab something as simple as a kinstretch cup. You can use a ball, you can use anything that you can put force into as we go through this little exercise. So as I take my kinstretch cup, I'm slowly going to squeeze, but I'm only going to use my hands. As I start to squeeze, only using my hands, I'm going to start to engage more contractile force as I let this contraction spill up into the forearm. From here, it's going to keep going, and I'm going to push it up into the bicep. Now I'm squeezing my chest. As you can see, more pressure is getting put into the cup. Now I'm tightening my abs. I'm squeezing my glutes, tightening my legs, and this is as much contraction as I can put into this. This is 100% contractile force as I push into this and relax. If that was 100% of contractile force, as we go through our controlled articular rotations today, we're going to keep about 30% into that. So we're always going to have a sense of irradiating into an object for our controlled articular rotations. This will help facilitate the joint that we're looking to isolate, and it'll also make the rep a little bit more challenging. So let's get started. We're going to take our cup, our kinstretch cup, as we bring our head down, squeezing, putting force into it, slowly looking over that left shoulder, tipping that ear to the back side of the shoulder as the head drops back, looking over the right and all the way back down to the center. That's one rep. Shake it out. We got a couple more. We're going to do these on the 2 minutes, so start squeezing. You can change position of the cup, of where you're squeezing, where you're tightening. So chin comes down to the center of the chest, looking over that left shoulder, head reaches back, tilting backside, over, chin comes back around to the center. Good. Rep 2, shake that out. Squeeze again, maybe just squeeze here, see if that isolates a little bit more. So chin comes down to the center of the chest. I'm going to change directions. Ear comes down, up, around, back down to the center of the chest. Good. Switch it again, maybe on this side. See if it's different. Chin comes down to the center of the chest. Looking over that right shoulder as far as you can. Right ear reaches down, back, around, back to the beginning, and there. Good. Maybe put it in between the legs. See how that goes. Tighten the abs. Tighten the fist here. So chin comes down. Looking over my left shoulder as far as I can. Dropping back, around, back, and there. What you might find is as you're squeezing and irradiating, the rep starts to go faster because you're squeezing and you want to get it over with. So pay attention if you're just trying to go through the rep really quickly, like I just did. So I'm going to make it more intentional. So squeeze. Chin comes down to the center of the chest. Slowly looking over that left shoulder. Left ear reaches to the back side of the shoulder. Head looks all the way up at the ceiling. Looking over that right shoulder. Right ear comes back down and back to the center. Much more different rep than the one I just did. So we'll go to the thoracic spine. This one I'm going to squeeze here. So flex that spine. Rotate. Lateral bend. Extend. Full extension, rotate, lateral bend, back and around. Good. Creating tension onto your kinstretch cup or ball or whatever you have. This one's going to go in between the legs. I'm squeezing the cup, flex, rotate, lateral bend, full extension, back, over, down, and again. Thoracic spine is tricky. You're going to find that sometimes you're going to feel out of your element with it. Understanding that the thoracic spine doesn't extend as much as you think it would, but it definitely will flex as much as you want it to. Now, that being said also, we want to think about where we're moving from. For this, we just say like T6, so the middle of the back is where the apex point is going to be. So back and around and there. Good. So, 1 second. All right. Let's do another rep. This time I'm going to squeeze that cup into me so I can really focus on where I'm moving from. So flex, rotate, lateral bend, full extension, full rotate, lateral bend, and back and around. Excellent. We're gonna go to the scapula. For this, we're gonna do one arm at a time so we can focus on the irradiation component of this. So I'm gonna squeeze my kinstretch cup. I'm going to protract, elevate, retract, depress. Protract, elevate, retract, depress. Change your angle, protract, elevate, retract, depress. Keep squeezing, protract, elevate, retract, depress. Change the angle, protract, elevate, retract, depress. Protract, elevate, retract, depress. Good. Let's go with the other hand, the other side. Protract, elevate, retract, depress. Protract, elevate, retract, depress. Change my angle, protract, elevate, retract, depress. Really squeezing that cup. Protract, elevate, retract, depress. Let's go both arms. I'll put the kinstretch cup in between. Squeeze, tighten the abs. Protract, elevate, retract, depress. Protract, elevate, retract, depress. Protract, elevate, retract, depress. Good. We'll go right shoulder now. This I'll do from a kneeling position. So I'm going to squeeze my kinstretch cup. Once it stops, you're going to spin, keep spinning, keep spinning. Keep spinning, pushing back, pushing back, pushing back. And there, and reach back. And spin, up, and down. Good. Keeping pressure on the cup is going to turn this into more of a workout than it is just joint circles. So you'll really see the difference, creating irradiation into the object. Back and around. Up, back, around. Good. Go ahead and keep that going. Start up. Find that end point. Start spinning as you press back, 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 and around, and there. Go from the front. Start spinning, squeeze that cup, squeeze, push back, push back, push back, and down. Good. One more time. Push up, push up, push up. Pull it down, tight, 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 back and around. Remember, as you reverse, depress the scapula as you're coming up and over to really dissociate that scapula from the glenohumeral joint. Remember, we don't want that scapula coupling improperly soon. So let's go to the left side. This time we're gonna go from here, reach up, squeeze that cup, rotate, push back, push back, push back, and down, and reverse. Push back, push back, push back, and down. Good. This in side lying is really interesting because you have gravity, which will help you push over. So up, up, keep squeezing, keep squeezing. I got a little visitor here. Around. Let's go here. Up, 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 back, and around. Distractions make this. All right, jumping to the right hip. We're going to take our kinstretch cup. We're going to squeeze, flex the hip, abduct the hip, internally rotate the hip, extend the hip. Again, squeeze that cup, squeeze the abs, abduct, internally rotate, and push back. Really important in the internal rotation of the hip that you don't come over, that you feel that femur rotate. If you need to make the range less, that's totally fine. Just keep that internal rotation, which is the most important component of this. The cup really does help with irradiating the hip. So flex, abduct, internally rotate, and press back. Good. Go from a sideline position. Again, if you're brand new to the hip car, going from a sideline position is really helpful. So go down, squeeze, and back, and up, and rotate, squeeze, and back, up. Really squeezing that kinstretch cup, keeping that irradiation going the whole time. Science says kinstretch done with your dog makes each rep 10% more effective than the last. Good. Squeeze, squeeze, squeeze. Abduct it. Internally rotate it and push back. Excellent. I'm gonna go other side. So again, we'll hop up first. Take your kin object and flex. Abduct. Internally rotate and back. And flex. Abduct. Internally rotate and back. And back. Good, these are a little exhausting, so if you need to take a little break in between, feel free, but right back into it. Good, go from sideline position, down. Get into your best draw me like a French girl position. So squeeze, abduct, and back. Trying to minimize as much movement from the pelvis as possible. Good. Couple more reps. Really find those transitions from flexion to abduction to internal rotation into hip extension. And flex and down. Play with the transition points. Internally rotate and back. Internally rotate and down. Good. Let's get set up for our tibial car, working that tibia. So I'm going to take my kinstretch cup and I'm going to squeeze it here so that I can get set up. Again, with the tibia, you want to make sure that it's rotating and you're not getting any movement from the hip. So lock that hip down, squeeze that cup, and rotate that tibia and back. And rotate that tibia and back. And rotate and back. Good. You can try this in a number of different positions. So if we go from a combat base with a foot flat on the floor, you can hold the knee in and you can rotate, pressing through the heel here. Really make sure you're isolating that hip. All sorts of options for tibial rotation, but find that if I'm in this position, I can get like a Johnny Fights a lot, hold on it and rotate that tibia, squeeze and rotate, squeeze. Good, good. Making sure that tibia is getting as much movement as possible. From here, we're going to work on dorsiflexing the ankle. That way we get shifting of the calcaneus underneath that tib fib. There's a neurological benefit to this, but we'll keep that out for next time. So just take your knee and drive it forward. trying to close this angle of the joint, coming back out, pressing forward, coming back out, pressing forward, getting that calcaneus to shift. Sorry, the talus. The talus is shifting from the displacement of the tib fib. But go through that. Good. Let's go left tibia. Here, I'll get into this position. Rotate that tib and back. Rotate that tib and back. Rotate that tibia and back. Rotate that tibia and back. Tibia and back. I'll grab my kinstretch cup, squeeze, make this a little bit more of a workout here. Rotate and back, rotate and back, rotate, back. Maybe change positions again here, getting locked in. Johnny Fight style, and seeing if I can rotate that tibia in this closed angle position of the hip. Go. Really hold it so it doesn't come out. This is going to be a much more difficult movement because you're really locking down the hip. So give that a couple tries, and then again, we want to create dorsiflexion so that the tib fib displaces that talus. So drive that knee forward, keeping the heel on the ground. If you need to back the knee up, that's a little bit, that's fine. There, driving it forward. You can lean on it, you can push on it, do whatever you can to create this. Really want my knee driving over my toe. Knee drives over the toe. You can see this. Want as much dorsiflexion as possible. Keeping that heel down, knee driving over the toe, displacing the talus bone right there. I'll squeeze my cup for this. Push it down. Push it down, hold the ankle down if you need to, press and displace. Press, good, there, press, displace, and squeeze that kinstretch cup. Awesome, great. Excellent, so that's a pretty good rundown of our controlled articular rotations using the concept of irradiation. Again, the more we irradiate with an object, the more neurological drive you're gonna put into that controlled articular rotation. So this is another way of looking at controlled articular rotations as a training stimulus rather than just getting proprioception to the mechanoreceptors that reside within that fascia that we rarely use. So we're gonna get into a fun bout of pails and rails. All right, so our pails and rails setup is going to be from a half straddle position. So I have two dumbbells here. You can use anything just to block the legs from coming in, and you're gonna push yourself into a passive stretch. Obviously, you're gonna feel here. And we're going to hang out here for 2 minutes. So as we're doing this, just take note of the stretch sensation that you're pulling, focusing on the breath, inhaling, we can work on a round of maximum expansion breathing here, if we like. The main important goal is to make sure that no length is taken or given. So I'm not pushing forward, I'm not pulling back. I'm literally just sitting in a passive stretch, and I'm just letting the tissue be on load without me forcing anything. And then when the 2 minutes is up, our pails progression is we are going to start imparting force this way, and we might have to make it an isometric contraction. You can use your hands here as you pull in, and then our rails progression is we will push ourselves forward to try to create more space in the hip joint and abduction of the hip. So we got about another 60 seconds before we start irradiating into the weights, and that contraction is going to start very small and we'll slowly work up in increments of 10 once we get to that maximum contraction of 80%. So again, just holding this stretch here, 2 minutes. Think about using this time just to let your mind go. It's important to breathe. We got 20 seconds. When I say we're gonna start to create our contraction, pushing into the weights, trying to bring our legs together this way, but the weights or your object is not going to let you. So slowly start creating that contraction, pushing into the weights, 10%. Slowly ramp that up to 20. 30%. 40. 50. Getting a little harder. 60. 70. 80. Strong and safe as contraction, and hold that for 10. 9, 8, 7, 6, 5, 4, 3, 2. Freeze, let go of the contraction, and take your legs off the weights. Lift them, lift them, lift them. 5, 4, 3, 2, and rest. Good, take a breath. Good, and this new range we're gonna hold here for another 2 minutes. Good, just holding here, finding that stretch resiliency. Getting that breath to recover from that last rep. Good. If anybody has anything to talk about, go ahead and put it in the comments right now. Could be a fun way to pass this 2 minutes. Maybe tell us your favorite colors that you inhale and exhale with. I tend to go with lime green and some fuchsia. Those are my fun colors, but you can pick any ones you want. I don't judge. Good. About another 40 seconds, and then we'll start our rep number 2. Do this every day. Pretty soon you'll be like Jean-Claude Van Damme, who can kick stuff. Go ahead and type in the comments if you've seen JCVD. It's a pretty funny flick. All right, slowly start creating a contraction, pushing into your weights or object. 10% contraction. Slowly ramp that up. 20%. 30. 40. 50. 60. 70. 80. Strongest, safest contraction. Hold that for 10. 9, 8, 7, 6, 5, 4, 3, 2. Freeze, let go of the contraction, and pull your legs off the weights. Pull, pull, pull. 5, 4, 3, 2, 1, and slowly come out of that. Excellent. Excellent. Of training here, we're going to take an object, prop it up so that we can put the hip into flexion and abduction. From here, we're going to place down, and we're going to lift and do a 2-second hold, and we're going to do 10 reps on each leg. So it'll be 1, 2, 3, 4, 5, 6, 7, 8, 2 more, 9, 1 more, 10. Good, good. The other side, same thing. Flex, abduct the hip, squeeze, lift, and hold. 1, lift, and hold. 2, lift, and hold. 3, lift, and hold. 4, lift, and hold. 5, lift, hold. 6, lift, hold. 7, lift, hold. 8, 2 more, lift, 9, one more, lift, and hold 10. Good. Now we're gonna add a knee hinge to it. So flex, abduct, lift, extend, back, down. Lift, extend, back, down. Only 5 of these. Lift, extend, back, down. Lift, extend, back, down. One more. Lift, back, down. Good. Come on over here. Lift, extend, back, down. I got this. Lift, extend, back, down. Lift, extend, back, down. Lift, extend, back, down. One more. Lift, extend, back, down. All right. So today's class is a little more challenging. Adding that irradiation component definitely makes things a little more interesting. So let me know how you guys like the class, if there's any requests that you have. Next one, we're probably going to get into some upper body stuff. But other than that, stay safe, stay healthy, stay moving, and I'll see everyone soon, hopefully. Have a great day and a great weekend. Out.